that we're in the middle of what's looking like it's going to be, a long-term pandemic. We just really didn't know at that time, in early March, what we were facing. But, to the credit of, our committee staff and leadership and, probe staff, everybody just sort of jumped in, and we worked with USDA really quickly to sort of figure out, okay, what can we do now? What flexibilities can we provide? So I think the member gave a good summary of what we did sort of early on in the HEROES Act in May. The member has been very vocal that, hey, we helped a lot of people with the provisions in Families First and CARES Act as it relates to the nutrition title, but there's still so much more that we want to see through, and there's still a lot of groups that didn't necessarily reap the benefits from those provisions. I think, you guys are all fighting for the 15% increase in SNAP. That's a big one that was in the HEROES Act. She talked about the minimum benefit increase and the suspension of the mandatory employment and training requirements. But I think one of the biggest provisions in the HEROES Act is suspending all 3 of the harmful SNAP rules coming out of USDA. I think that's a pretty big one that we really want to see through. The Families First Act did suspend the ABOD work requirements, but it does not suspend the ABOD rule, and it does not suspend the 2 other rules as it relates to the standard utility allowance and categorical eligibility. So we definitely want to see that move through. We also provided an additional $150 million for administrative funds for states, which I'm sure Kevin can speak to, that is definitely needed. She talked about hot foods. That's something that I think we've been discussing for a while now. Another interesting provision that was included is that it excludes the $600 in pandemic unemployment compensation from being counted as income for the purposes of determining SNAP eligibility and benefit levels. I think that's really important. We've had lots of discussions about what should be excluded, what shouldn't be excluded as income during this time, but that was one that I think we could all agree on at the time when we got the HEROES Act pushed through. Pandemic EBT. It's another big one. We've expanded it even more in the HEROES Act, expanded it to include children under the age of 5 impacted by childcare closures, which is pretty big. We've also increased enhanced the federal match for states. So instead of states that operate pandemic EBT only receiving that 50% match in federal money, the federal government would fit the entire bill on administrative costs. I think that's a big one. We keep seeing more and more states taking this up. I think we just saw South Dakota and South Carolina. A lot of the red states are coming on now, so we're very excited about that. But I think we can get more states if the HEROES Act provision passes, especially with that enhanced administrative match. We did some other things in there, adding the territories and sort of cleaned it up a bit and addressed some of the administrative issues that we were hearing from states. There's some additional money in there for food banks. Again, I can't say enough about the work that our food banks have done. Tiffany, folks at the Greater Cleveland Food Bank, the folks at the Akron-Canton Regional Food Bank, the folks at the Ohio Association of Food Banks. I mean, there's so much work that has been done on their part. So there's another really cool provision in there that the boss championed that provides $25 million to an existing program called the Farm to Food Bank program, where states can submit plans to USDA to basically cover the administrative costs associated with donating food to food banks. I mean, we want to do everything we can to incentivize farmers to give that leftover food that the member was talking about. We don't want milk to be dumped. We don't want food to be plowed over. So whatever we can do to cover the cost of harvesting, processing, packaging, and transporting those goods to food banks. Those are all things that we want to see done. We have a lot of work that we're trying to push that along. I think we're about 35 days out from the passage of the HEROES Act, and still we have no Senate action. So obviously we want to see the Senate take action on these pieces. But there's a lot of other work that we're doing. We're trying to push for college students to get relief. We are working on increasing automatic eligibility in WIC, expanding after school meals programs for students. I mean, there's so many things that our office personally is working on in this fight. So I think that's kind of the overview. Happy to answer any questions about any of that, but
wonderful. Thank you. That's so helpful. And even some of it that I think I track this stuff closely, and I didn't even know some of those provisions that you guys are working on and that were in the HEROES Act. So that's awesome. And we're so glad that we can always come to you guys and say, we have this idea. Does it make sense? Is it, feasible? And we know that if it does, then you'll do whatever you can to make it happen. So I want to take the conversation now sort of down to the ground. So we talked about sort of what's happened in Washington and what has been passed and what resources have come our way. And so I think let's talk about now sort of how that's affecting the community, how those resources are reaching folks. So, one just point of clarification for anyone who isn't familiar with pandemic EBT, we in Ohio have just really been rolling it out over the last couple of weeks. So folks who already get SNAP got it at the end of May on their SNAP card, most of them. And other families, school children who were missing out on their school meals got a PEBT card in the mail or will get one in the mail really by the end of June. So a lot of families started getting them this week. We started hearing the calls, like the cards are hitting the streets and people were activating them. So we know that it's out there and, that we're getting a lot of feedback from families who are, just so appreciative that resource has come through to them. So Tiffany and Zulma, let me start with you. Can you tell us about, maybe Tiffany, you could go first, about how, what you're seeing on the ground, how these resources are reaching families, and what else is there, what's still needed in addition in the hunger space to kind of fill that gap that you guys are really the first line of defense for?
Well, happy Friday, everyone, and truly glad to be a part of the conversation today. Just for those of you who are unaware, we have been in the business of helping individuals not access to food resources, but also those important critical SNAP, which is known as SNAPs. So for us, in terms of food banking, we have served 81,000 individuals since COVID-19 began. And for us, that was pretty significant in terms of the needy community. Actually, 21,000 of those individuals were first-timers have never received help from the bank. So we need rate. Our job is to continue to create awareness so that individuals know where to receive help. So in terms of those first-timers, there's a lot of confusion. Where do we apply benefits? How does unemployment work? So really trying to be available to answer those questions. And we were able to achieve that as we offer a call center. So individuals can receive that support over the phone, particularly with COVID-19, not wanting to have a lot of face-to-face conversations. For partners like HSAN, which Zuma leads, we appreciate you still being open and being available to the community. We recognized that there were some locations where communities had to close. So there were some sites that were not in operation, but that's okay. We were still able to increase our own distribution and to work with organizations who were able to still be open to meet the need.
Thanks, Tiff. And I think I caught most of that. You were breaking up just a little bit, so we may I may come back to you and ask you another question there. But yes, you guys have been doing a tremendous amount over the phone. And being sort of there no matter what, right? You had the National Guard there, like people knew that come hell or high water, the food bank was still going to be open and you were still finding a way to get food to people. So, so much respect for the entire team there that made that operation possible. And you told me a couple of times that when I would say, hey, Tiffany, remember this thing we were working on before? You're like, we're a food bank. We're distributing food right now. All the other stuff has to stop. And that's exactly right. You guys always kept your eyes on it. So thank you for that. Zulma, can you tell us from your perspective, what's the experience of hunger been on the ground, and are these resources seeming to reach folks that you serve?
So yes, we remained open the entire time. So we were actually able to see sort of a wave, in the needs and as they got met. All of these services, all of the efforts, all of what Congresswoman Fudge shared, you know, with the Center for Community Solutions, the food bank, all of these measures taken have definitely made an impact in the community in a positive way. Again, from being open through March, seeing people coming in requesting food and assistance in that area that weren't necessarily always the request, seem to, you know, sort of go away as some of these services have become more available to families and the access is readily available to them. We don't see as much requests. I will say our greatest vulnerability that we've seen still is with seniors and their access to food. You know, we have received more food assistance from the various funders and collaborations that we have as a senior center here at East End. However, much about access and how they could get to things, that still remains a real challenge amongst our seniors here in the city. But again, just like to stress that everyone's efforts around making sure that families got food through all of these amazing efforts by all of you have certainly touched our families. My fear, and I won't get into it unless we go there, is what will happen post this matter, because I know some of these things are, you know, as the Congresswoman said, you know, some of these things that were lifted and removed for the moment to deal with our urgent matter now will not necessarily be the reality post. And, you know, that unequal social and economic reality to our marginalized communities will become very real post, you know, some of the changes that will naturally occur around all of this wonderful work that now has made a tremendous impact, the shift. And of course, I'm concerned about that.
Yeah, thanks for raising that. And I think, yeah, a good example of that is the emergency allotments. I know Congresswoman Fudge mentioned that at the beginning, but, you know, for those who don't know, anyone who receives the less than the maximum benefit on SNAP has been boosted up to the maximum. So that is an especially important, right, for seniors who often, or individuals with disabilities who often receive less than the maximum benefit amount. They've been getting a boost. But you raised a great point about having the funds doesn't always translate into the access, you know, the ability to go shop for that. And so some things have happened, but come slower than we would have liked for things like home delivery, some of those things. So I think you're right. We need to keep our eye on that. And those emergency allotments, we don't know if they will extend past June, I think, at this point.
Right.
Kevin, since we're going to talking about SNAP, can you tell us just what the experience has been for your agency, getting the SNAP applications you've been getting and how you guys have weathered this crisis so far?
Sure. Thank you, Rachel. And thanks to the Center for Community Solutions for putting this on. Good to see everybody here today. We have seen, first of all, for the first time in our history, the majority of our staff are actually working from home. So on the state's side, they work diligently with us to actually mobilize that and get everybody home access to our system so that we can actually still provide benefits and provide a safe environment for our employees and for the public. So most of our benefits are actually at this point, essentially all of our benefits and all of our interviews are taking place over the phone and online. We have seen starting really late March and through April, a significant increase in SNAP applications. We were seeing 2 to 3 times the number of SNAP applications per day in mid-April, and that was sort of the peak. And as that happened, we were able, because of the, and thanks to Congresswoman Fudge and her advocacy there, those relaxed guidelines around the need for an interview. If we can electronically verify, we don't need to do the interview. The recertifications were waived for March, April, May, and June. The interim reports for the same time period were waived. So a lot of that administrative and sort of maintenance of effort work that we normally do was waived during this pandemic through June. And that's allowed us to focus on the applications. And so I say double to triple the number of applications on those days in April when the pandemic was really starting to hit and people were really starting to lose their jobs. We've managed to address all those and get benefits for those individuals. In the month of April, we saw a 30,000 person increase in SNAP benefits in Cuyahoga County. So we went from just over 208,000 people receiving SNAP benefits in March to 238,000 people receiving SNAP benefits in April, and continue to receive them today. And I was just looking at these numbers right before the call. That's actually, that coupled with the maximum allotment that a couple people referenced earlier, has resulted in more than double the amount of money in SNAP allotments out there in the month of April. We normally see $25 to $26 million in SNAP being issued a month in Cuyahoga County. In April, we saw $55 million issued in SNAP. So we've seen a drastic increase in the need for the services, and people are getting those benefits during this pandemic.
Thank you, Kevin. And I'll just say we've been talking about access for about a year now with you directly. And one of the things that's been most incredible to me is the wait times, how far they've come down on the call center. I mean, really, we've sort of, it can't be overstated how much of a difference it makes in people's lives when they're waiting, 2 or 3 or 5 minutes on the phone, and then someone says, I can help you, I can do an application with you, versus 45 minutes or an hour and a half, depending on how much other work is going on at the agency. So I've been really just heartened to see that. And we hear the feedback from the food bank and from other places that takes a lot of relief off of their agencies and the troubleshooting that they need to do to help folks get benefits.
Thanks for pointing that out, Rachel. It has been, we've had historic improvement in that contact center, the eligibility contact center. Our wait times have drastically reduced. We've been under a minute all of the month of June, and people are getting to us much quicker. It's allowed us, and repeat calls are no longer an issue. We're getting to people. The staff at JFS have really responded to being at home. They kind of like being at home. I'm going to have trouble if I try and bring them back.
Terrific. Great. Well, I'd like to talk a little bit about what else Eyang shared a lot of the things that they're trying to do and the things that they're working on. I think maybe let's talk a little bit about what else we as advocates, as members of the community, as voices that represent this district or these set of districts, what we kind of can be doing to help move along the kind of things we need to see at the federal level or the state level to really help address this food insecurity crisis. Because I don't know if anybody explicitly mentioned it yet, but the food insecurity rates that we're seeing are like nothing I've certainly ever seen in my lifetime. I mean, we're seeing in some surveys, a third of mothers with children reporting food insecurity, meaning like they don't know where their next meal is going to come from. They don't have enough money to afford the food that they need. And I've, even in the height of the last recession, it didn't get close to that level. So let's talk about kind of what more we need to be doing. Tiffany, I want to give you another chance. What's on your mind? Like, what are you at the food bank talking about that you need to do to respond to the need that's still at your door? Mute.
Can you hear me better? Is this better?
Excellent. Yes.
All right. I apologize. That technology at its best. Some efforts that we're doing to serve our community. You're absolutely right. Right now, child poverty rates are 3 times higher this summer than they were last summer, according to Brookings Institute. And so flexibilities around our child nutrition initiative have been excellent. For example, right now we're able to distribute grab-and-go meals to out in the community, which means that parents, even if they're not with their children, can actually come and receive meals to take food home. And because of flexibilities like that, we've actually served 12% more children, which is about 2,000 meals in just the first 2 weeks of these efforts. And so we need to continue to make sure that our senators know about these flexibilities and these reduced nuances so that our children can continue to eat. We recognize that because of the pandemic, that some of our sites that would have traditionally been a part of this efforts, for example, all of the libraries, the rec centers, they're just not able to support this effort. So We're out in the communities with the support of those 56 sites that are open, but our team is actually taking on a mobile program to offer both east and west side locations to make sure that we're available Monday through Friday to meet the need of the children in the community. So just continue to let your senators know that those flexibilities are important in terms of child nutrition initiatives that we're currently up under. The waiver is supposed to expire August 31st. And so we're thankful that that was extended beyond the June 30th original deadline.
Thanks, Tiff. And how about for you, Kevin? What are the flexibilities that you guys have had and are, facing down, potentially going away, that is going to impact your ability to meet the needs of the callers you get and the folks you serve?
So some of the flexibility that we've been given, I mentioned earlier, but the interview is no longer mandatory. If we can e-verify, we can electronically verify income that concurs with the client's application. We don't have to go forward with an interview, and that's been very crucial in the speed of processing these applications. But also the certifications and the interim reports have been waived during this time period, so we don't have that recertification interview at 12 months. All of those that were supposed to happen in March, April, May, and June, we don't have to do those. And the same for the interim reports. People do not have to file interim reports during that same time period. As of now, we're planning for July. That is restarting. So we have some concerns moving forward with regards to that. We've already proactively started to work that to get out ahead of the issue. But that part is going away. The ability to we at the beginning of this pandemic, we granted good cause to our constituents. So for work requirements. So we did not. So in recognition of the pandemic and the conditions around that was creating in terms of being able to put someone in a work placement, we granted good cause to our constituents so that they don't have to meet the requirements. We still have to assess them. We still have to refer them, but they don't have to meet the requirements. There's no sanctioning or anything like that going on right now. Same is true for our cash program. So we were in the state, we did that conversations with the state. That's something that a lot of counties have done. Cahill County, we did that on March 17th. So that's a flexibility that we've been afforded right now has really helped us get to all the work and to keep people receiving their benefits.
Yeah, thanks. I know we are continuing to help support that ask, hoping that FNS, as Eyang was saying, will take advantage of the flexibility that Congress gave them to continue to support states as they're trying to meet the needs of SNAP households. I want to shift now. We've got I'm going to give our panel about 10 more minutes for us, and then going to open it up to the questions. I've already gotten some in. I want to talk a little bit more about the folks who have been left out. I will say the folks who are not, who the support isn't reaching, either because they're not eligible or because they are more fearful of receiving things like SNAP. Our immigrant families is one that we know have been especially vulnerable right now. I know, Zuma, you mentioned seniors are having unique challenges right now. So maybe, Tiffany, can you just say a little bit about how the food bank serves folks that it fills gaps in ways that go around SNAP and some of the other programs that are there for literally anyone in the community, regardless of their situation. Can you just speak to that a bit?
Sure. So just like to reference, we're currently offering, for example, weekly drive-through distributions where anyone has the opportunity to come and receive food. We've had individuals who are non-English speaking, so we've had interpreters there to make sure that they're able to access that product. And that, because of some of the flexibilities in place, we've not had to collect some of the information that traditionally pre-COVID-19 we would be responsible to collect. So that has been excellent, and we hope to continue to be able to offer that support. We recognize, though, that, as I mentioned, individuals are afraid to apply for those benefits, but they still need to eat. And so coming to the food bank or to a partner organization, it's a requirement that we feed those in need. So we're excited to be able to continue that work for those individuals.
Thanks. And Zulma, how about you? What do you see? Go ahead.
So I wanted to comment to this word that keeps coming up as we explain flexibility. And that's, that's the part that I would like us to spend time on as we get hopefully past COVID. And that is the requirements again to be able to get assistance, for food and your basic needs. For us, it's about connecting the dots. I run a multi-service center, so I don't have the luxury of focusing in one subject area. I'm constantly having to connect the dots between seniors and children and families and individuals. And I think that we have to make sure that in order to be able to service communities, that we need to think beyond, that focus that we each have. We're talking about food, but how does that relate to minimum wage? How does that relate to the fact that people are unemployed? How does that relate to the fact that you have a senior that doesn't have the same access to some of the same resources? And so we got to start thinking a little bit more collectively on how we cross each other's departments and areas and focus so that we could eliminate these barriers. Because now, to me, it was easy to see, obviously, we have allowed ourselves to be vulnerably human. Right? Understand that, we don't want COVID to take anyone's life away. We don't want COVID to keep anyone from access to resources. I'm asking us to remain in that state, right? Because we realize that people who have been marginalized or most vulnerable, we don't necessarily see them all the time. We put these barriers in the way that we call them policies and rules and ways of holding each other and them accountable. But in some ways, we're actually harming them to be able to have access to those things that they need and even be able to move beyond that. You have the working poor parents who are working every day and have some of the same similar issues as my parent who's not working. So I'm just, I really hope that we begin to really be more focused around connecting the dots across the board of all of the needs that, people in our community have.
I think that is so well said, and it really leads to a question that I have for all of you, and I welcome anyone to respond to it. Today is Juneteenth. I think our
Right.
country has gotten an education. Certainly, white women like myself have gotten an education in the last handful of years in a new way about the importance of understanding systemic racism and listening to the voices of those who have been experiencing it their whole lives. So. And looking at the food insecurity rates in particular, I think one thing I have really been appalled by to realize is that, the level of food insecurity that we're talking about the whole country experiencing now, and families with children in particular, those are the rates that Black and Latino children have been experiencing for a decade, 2 decades, 3 decades. And, so I think that there is a moment to call out our space, food insecurity, hunger advocates in general. So I think I'd just like to ask you all, what should we be doing today and tomorrow and next year to make these programs more responsive and to people of color, and also to the point that Congresswoman Fudge makes, to really make sure that we're treating individuals with dignity, that folks are, and holistically. So Zulma, do you want to speak to that first?
Yeah, again, East End has always had a history that obviously in the last 50 some years, we've been unapologetically Black, because that's who we service, a community of predominantly Black members. It is the reality that we have to see the fact that there are communities that have been marginalized and not have the same access as others. It is a difficult conversation. It is an uncomfortable conversation. Those of us who are most educated swear we know it and realize that we don't. We have to be okay with that. And we have to be able to come to the table, like right now, if we're talking about food, what are the things that we need to do to make sure that people always have access to food, not just today where we're facing COVID, but beyond COVID time, right? And so then we have to get real about, well, why is it that some people are getting it this way, but some others are not? We got to get real about that. And we just got to get past, maybe some fears and I don't know, just uncomfortability about understanding that it's happening. Juneteenth was about the reality that some people still didn't know that slavery had been abolished. I think we need to recognize that some people are still facing the real ramifications of that time today in 2020. That's real. We got to address it head on with courage.
I agree. If I can also add, Zuma, you've made very good points. I think that, for example, when we look at the unemployment rates, we know that in communities of Blacks and Latinx, that those rates are 2 to 3 times higher, right? So that structural racism that we've been talking about, particularly after the tragic events that have taken place these last couple of months, I think it's important for us to pay attention to the resolutions that have been introduced to both House and Senate by the Ohio Legislative Black Caucus, and we continue to support those efforts. I hope that we stay tuned for the work group that was asked to be created with Governor DeWine to see how we can truly introduce policy and parameters to support the populations that have been historically held back from a lot of the luxuries and a lot of the support that they need to thrive. So Zuma, you've made, I totally agree with what you're saying.
Thank you, Mrs. I agree with you.
Yeah, and I'm sorry that the Congresswoman is not here for this last question, because I feel like she would say something truly dynamic in response to this. But you know, what I can say is that the Congresswoman has long talked about, you know, hunger programs can't do it alone, right? I mean, we need to, you know, these communities of color have long experienced inadequate access to healthcare and housing and transportation in order to access nutritious foods, housing in areas where they're not having to reside in a food desert. You know, equal access to, you know, farm and agriculture loans for, you know, farmers of color has always been an issue, so that we can, you know, so we can harvest our own food for our own communities. Those are things that the boss, you know, talks about a lot. You know, inequities and economic opportunity and educational opportunity. I think those are all things that lends itself to our people that look like me ending up in situations where they have to apply for federal assistance, whether it be food assistance or what have you. And so I think when we're talking about, you know, hunger and we're talking about how that impacts people of color, we have to talk about it much more holistically. You know, our programs can't do it alone. I mean, we you know, we in Congress, we're shining a light right now on the fact that, you know, the COVID bills, COVID-19 did not create disparities in our communities. All it did was, you know, exacerbate and shed a light on what we already knew to be true. And so I think, you know, we need to make sure we're taking this time to fully understand why we are in this situation. Why do we have inequities in access? And then only then can we sort of figure out and take the steps to address those inequities. And it's going to take lots of legislation. It's going to take lots of groundwork. But I think as you know, as we continue these types of discussions, it'll lend themselves to you know, policies that will actually bring about change. So.
Well, thank you so much, all of you. So appreciated for your wisdom, and I hope to keep learning from you all and taking your guidance. So I'm going to turn it over to Dani for a few minutes to walk us through some Q&A, and then I will be back in a moment.
Hi, everyone. I'm Dani Carlson. I'm Community Solutions Director of Communications. We have gotten some questions coming in, and we welcome those in the chat box. Anyone who has any other questions that they would like to ask. So the first question that I would like to pose that was asked, someone says that they're pleased to hear about what's happening with children under 5, college students, and kids after school. But what is happening regarding food security for seniors? This person says lots of seniors are living at home. Can anyone describe some of the specific strategies being used? And I think, Tiffany, if it's all right, I'll start with you, with your expertise at the food bank.
Sure. So there's a few things that we're doing to reach our seniors. We definitely have some additional messaging for our seniors in terms of connecting them to food stamps or SNAP, because we know pre-COVID-19, seniors did not access the benefit because of shame, pride in just not being aware that they were eligible to receive that support. So we've created some additional messaging for our seniors. We've also taken a non-traditional approach, and we've been doing home delivered meals to seniors and our disabled and homebound individuals. And that gives us an opportunity to build trust within that population who generally in the past just wasn't sure in terms of where to get support. And also we realized that those organizations who traditionally provided that support have not been fully operational. So those are just some of the things that we're doing in terms of a food banking perspective. We also monthly have done deliveries for our commodity food supplemental program, which is our senior boxes, which gives our seniors another opportunity to receive food without leaving their homes.
Great. And if any of the other panelists, Zoma, I see you unmuted yourself.
Yeah, we obviously been working with the food bank and additional allotment that we've been given from our various funders, Western Reserve, Inclusive, and the county to service seniors. So we've been able to really increase the number of meals that we deliver home. So what happened was that all those seniors that were in our congregate program, now they're also part of our home delivery program, obviously for safety reasons. And so the increase was amazing for all of us. I believe every one of the senior centers here in town received a major increase in requests for meal delivery, in addition to those that they were already servicing and congregate meals. And so the assistance from the various funds and the partnership with the food bank have absolutely made us able to service that need. And again, shedding the light of something that is so important. And, you know, Cleveland, we got a major, you know, I know the Community for Seniors, Community Solutions did an amazing report of that. We have a huge senior community. It is here. And it's only getting older and sustaining. And so we have to make sure that we remember to connect the dots for them, you know, again, now and beyond COVID. But we've been able to service them, thankfully, with all the assistance and the different partnerships. I will say, I am the person who always highlights what's tough and challenging and what still needs to happen, but I will give Cleveland in this county, a serious shout out. We've pulled together really, really amazingly during this time, and that needs to be said. So although I bring out, you know, what's difficult and what still needs to be fixed, I want to highlight the fact that we have done an amazing job of coming together to service our community.
So at JFS, we really appreciate, we've been, as Rachel's mentioned earlier, we've been meeting and been in a partnership with the food bank and the center for really the past year and a half, and access to SNAP for seniors has been an issue that is incredibly important to us. We know from some work that we did last year that what we call the SNAP penetration rate for seniors just doesn't meet the need. We know there are more seniors who are eligible for it out there who need it, and it's actually kind of funny. I got an email this morning asking to engage on SNAP outreach and partner with our sister organization in Human Services, the Department of Senior and Adult Services, to look at how do we reach out to seniors and how do we get them enrolled in SNAP when they're eligible. This is, I think, some of the things Tiffany mentioned. There's some fear around the system, some misunderstanding around the system, and we want to get them the benefits that they need.
Great. The next question is sort of in a similar vein. Oh, I'm sorry. Did I cut you off, Eyang? Please chime in.
Can I add to that? And, you know, I know you guys I appreciate the work that you guys are doing on the ground. I just want to mention a couple of things just at the federal level that I think are worth noting as it relates to seniors. One, you know, states received additional money through the Older Americans Act that can be used for programs like Meals on Wheels. So that is another source of funding specifically for seniors. My boss has introduced legislation to, you know, put money into delivery specifically for homebound SNAP participants. As we can see, more grocery stores are moving online. You know, we want to do all we can to to put more money into delivering those groceries directly to seniors. Online SNAP, obviously Ohio is, gearing up to, if they haven't already, fully launched online SNAP for all participants in the state. That is something where we're seeing expanding all over the country. So that's another thing that's going to benefit our seniors, because now they can shop online and have those groceries delivered. The other piece that we're still sort of pushing behind the scenes is putting more money just into delivery into all of these programs. So when we're talking about the Commodity Supplemental Food Program, specifically for seniors, what can we do either now in a COVID bill or a future farm bill to put more money into delivery? I think this COVID-19 pandemic sort of let us all know, especially at the federal level, that we need to be doing more to get food into the hands of people that are homebound. So I just wanted to add those pieces.
Great, thank you. And I think I'll actually turn it back over to the capable hands of Rachel to continue with the questions. Again, just a reminder to everyone listening right now, please enter any of your questions in the chat box and we'll get through just as many as we can with the time that we have left.
Great, thanks. And I have a truly pandemic era background noise. So I was needing a child and a dog needed me at the same time. So I'm back now. So one of the questions, really good questions that came in through the chat was about pandemic unemployment assistance and how that interacts with SNAP. And I think that it's a complex and important question that we should just hit on if we can. So I think Eyang mentioned that you guys are working to have that excluded, that was part of the HEROES Act. Is that right? And right now, right now it does count as unearned income for SNAP. I think, Kevin, could you say a little bit about how that works and what kind of churn maybe you're seeing with folks kind of coming on and off of SNAP because of the effect of that income?
Yeah, so curiously, we haven't seen the impact of the churn yet. We have seen a little bit, but it's not as big an impact as we initially feared. But yes, especially with the pandemic benefits, so the unemployment benefits are larger than usual. It's making a lot of the people who, let me take a step back. We were given the flexibility to say if someone's applied for unemployment, when they apply for SNAP and they hadn't been approved yet or anything, we went ahead and approved them at their current income level and they were receiving SNAP. And a lot of people, when they started receiving unemployment, then were over income, especially at the new higher levels. So a lot of those people were removed from SNAP once they started receiving their unemployment. I've not seen a serious drop in the numbers of SNAP enrollees right now. As I said, we're at about 238,000 right now. But I do expect to see that in June as those reports keep coming back in. But yeah, when people receive their full employment, I wouldn't say most, I don't want to misspeak here, but we are seeing a significant number of people being taken off of SNAP because of that unemployment benefit.
Yeah, and I think while this is my perspective here, is that while I think flexible income is better than SNAP, right? Because people have lots of needs. They need to buy diapers, they need to pay rent. So I think it's tremendously important that unemployment assistance be there and continue to be there for longer. What I think is frustrating for families that we hear is the ways in which that sort of like you feel like you're about to catch up and get ahead, and then you lose your SNAP benefits. So you feel again like now you're back to filling a hole on food. So those are tough trade-offs. And we're really advocating for what was in the HEROES Act to make it so that those can be that income can be excluded for counting for SNAP, the way that it is excluded for Medicaid. So I have to imagine that that's made your job, Kevin, extraordinarily complex when sometimes things are excluded for one program and not another, and you are in many ways serving folks somewhat holistically with the benefits that you provide.
I'm sorry, Rachel, was there a question there?
Just I was going to give you, in case you wanted to say anything about the interaction between the benefits. I know this isn't a conversation about Medicaid, but you guys also provide Medicaid. Is there anything you'd want to reflect on in terms of how that program has been able to respond to the crisis and how you're able to connect folks to both programs together?
Yeah, so our eligibility specialists handle both programs. Whenever someone applies for, it's one of the questions we have when we meet on a monthly basis. You want to know how many applications we got for SNAP. We can't divest that from Medicaid. We always explore all possibilities for individuals when they call in. Do they need medical? Do they even possibly need cash, as well as SNAP? So we did see an increase in Medicaid during the same time period, not nearly as much as we saw with SNAP. Now Medicaid is about 370,000 people. During the pandemic, it went up to, I'm actually looking at had my charts up for myself. Yeah, it really only went up by about 10,000, 13,000 people to about 384,000 people on Medicaid. One of the things, and this is a SNAP's webinar, but real quick, one of the directions that the Ohio Department of Medicaid has given us is that no one is to lose their Medicaid benefits during the pandemic. It's the exact wrong time to be doing that. And so, while for SNAP, if you're over income, you lose your SNAP benefits, but if you're over income for Medicaid, you're not losing your Medicaid benefits right now. So that was a nice flexible change that Medicaid gave us. But we did see an increase in people applying for Medicaid, not so much for SNAP. And the unemployment benefit, that's an unfortunate thing, is people that they need that money. It is more flexible, obviously, than just SNAP. But as they were qualifying for that money, they were starting to, we were getting reports and they were being pulled off of SNAP. That was an unfortunate reality.
Okay, thanks. And you mentioned, Kevin, that you guys took some action I just wanted to clarify, you took some action around work requirements at the beginning of the pandemic. And so there's this distinction that everyone might not realize between the 3-month time limit, the ABOD 3-month time limit that Eyang is referring to, and the mandatory employment and trading program Ohio chooses to have. And so that's a place where there's opportunity for state advocacy, I would say. Can you speak to sort of how you guys manage to make sure that folks are, how you were able to do that, and also sort of what does the future look like in terms of mandatory and employment and training, as opposed to the continued waiver of the ABOD time limit because of the actions of Congress?
I will try. So the environment we're in now with my staff primarily, we working from the home, but also from our lobbies are closed, and most lobbies across the state in terms of job and family services are closed. We did receive a waiver for work assessments, so that when we do a work assessment, which the state requires to be face-to-face, is no longer face-to-face during this pandemic, and that's an ongoing exception. We don't have to do that. People are assessed and they're brought into, so for those who don't know, there are individuals who have the mandatory work requirements and work activities around SNAP, and they're referred to us. And we have, in Cuyahoga County, we work with 9 different providers to provide not just a work placement, we kind of refer to as that minimum requirement, but we have career path providers that work to get people into the healthcare industry, work to get them into manufacturing jobs that are sustainable in Ohio. And we continue to work on that, but as of now, that's all voluntary. So we are not requiring people to do that. We've recently reached out to everybody again. Our vendors have changed their models so that we're working in a virtual environment and offering online training and online job skills and resume building and all, so that we can still offer services online and over the phone. So with regards to the ABOD population, when it comes to the truly work required population, that 3-month time limit with people who are able-bodied adults without dependents, and those of you who are unfamiliar with the acronym, so if they don't have a child, they're not caring for a child, they're an adult, they're not deemed disabled, and they're receiving SNAP, they're likely to be to have a work requirement out there. The 3-month time limit there is what the reference that was made earlier is, that you can get SNAP for 3 months before the work requirement, and in a 36-month period before the work requirement, before your failure to meet the work requirement will knock you out, will get you sanctioned. In the pandemic, we're not going forward with that. We've granted good cause to the population. We probably have, at the start of the pandemic, we had about 4,000 people who fell into that category. I honestly have not looked that number up again recently, but we had about 4,000 people who fell into that category, as opposed to the just over 200,000 people that were on SNAP altogether.
Thanks, Kevin. And I'll just say, for anybody who's interested in this issue or has been working on this issue and wants to collaborate, you know, we are working to we hope to see Ohio kind of take some different approaches in the future, you know, that we hope that we have learned from this experience. And to the point that Congresswoman Fudge made, that the sort of punitive, how many hoops can you jump through to earn your food is, you know, it's not, I think, that in the ethic of what food assistance should be, and that many of us believe that it should be. So there's a lot of advocacy around that. If you want to get involved, certainly reach out to me and my colleagues at Community Solutions and the Food Bank and the Ohio Association of Food Banks and lots of other folks who are working on this. We're waiting for, I've got a couple more questions that are coming in, but I want to give the panelists a chance to sort of ask each other any questions. I don't know that this incredible group of 4 people has been together on a call together. And so if you guys have questions you'd like to pose or a comment that you'd like to make, I'll give you the floor for a moment.
Sure. Kevin, hi, how are you?
Good.
You mentioned earlier that the amount of issuance has gone up to $55 million. What was the initial amount? I missed that.
Oh, it's normally between $25 and $26 million a month.
Okay.
Cuyahoga Countywide.
Okay. Thank you.
What an impact for our grocery stores, right? For the folks that are where food is being distributed, recycling into our economy. I mean, that's no small number. So that's really wonderful to hear.
And that is something that often gets overlooked with the SNAP program. It does bring money into the economy. I don't think that could be understated. So it's even normally $25 million into the economy for food assistance. It can't be overlooked.
I think I just want to really, again, repeat the importance of talking across all of these amazing areas of services. I know Tiffany from different work areas because we've worked together in the community. So I get to talk to her a lot. And so I just want to really encourage, the importance of us talking across the different lines of the areas of services that we provide, when you mentioned the Older Americans Act, what you've done at the federal level, that went through Works and Reserve, which then goes through, the community. I think we need to understand those things, not just us as being in the front lines doing the work, but for our community as well. I would love to give you some of the details because I actually took the time to talk to some of the moms and people that we serviced before I showed up for this panel. And I will tell you, some of the things that they explained to me in terms of applying for services, getting food, getting through all of the hoops, confused me with 3 degrees. I can't imagine having to go through that. Like you said, I love how you say, jumping through these hoops to get food and to get assistance, to be able to pay your rent and survive, while you get that job that's actually not out there. And that's another, again, real conversation that we have to have. So I just really want to continue to encourage us to really cross these lines, not just on behalf of each other, but for those people that we actually service.
So true, and it's so hard. And so
it is.
Yeah. And I know that even just to get even just to get workforce programs aligned, I mean, just to get the work requirements aligned between, we're talking about supposedly having a Medicaid work requirement in Ohio. And so, yeah, the challenge is big. And I think that we often, our skill sets can be divided. There's the policy wonk brains and the folks on the front lines, and we do have a disconnect. So I think, Zulma, any ideas that you have or ongoing conversation we can have about bringing more folks to the table. I'll just mention we have just a budding kind of conversation that we get to have with County JFS every once in a while, some groups. And I think the more we can bring more folks into that conversation to help share that what is confusing, what's frustrating, where are they getting stuck across the programs that just that agency provides, is a first step. And I'm appreciative that Kevin is open to being part of this community and conversing with us and taking our ideas back, because he's done a lot of that in recent months.
So,
I would say, you know, if I may, I'm sorry, but I would say that it is difficult. It is really difficult and challenging. But again, as someone having to run a neighborhood center where I have to become familiar, not just me, but my staff, with all of the different lines, because we don't get funding from one entity, right? We get funding from different entities, and we have to figure out how to sort of combine all of the policies and all of the requirements that each have for us to deliver one service, right, to the families. So I'm saying that to say that it's doable, that it's hard work, but it's certainly doable, and we have to be just really willing to cross those barriers. Like, do we engage the community? I certainly always provide East End as a space if we wanted to really know some of the things that people are really struggling with. Coming into the community and having actual conversations. I realize that that's time consuming. We don't have to do it like every month, but we got to try to close the proximity amongst us in order to know what it is that we do next. We're doing it for COVID, right? COVID forced us to take certain steps that we didn't have before COVID. So I'm saying it is possible, it's hard work, but obviously we proved to COVID that we could do some things that we thought we couldn't do.
So building on that, keeping the conversation going, we've been doing quarterly at JFS. We've been doing quarterly community forums where we invite our community partners, probably most people on this call, to join us. Last one was virtual. The next one will be virtual, but we have another one coming up in July. We'll have 3 sessions to try and accommodate people's schedules. We give an update on where we are with our programs and with our services, and a lot of it, but the majority of the forum ends up being question and answer from the community, which is really things we need to hear from everybody. We need to know where we're falling short, where we can help you, and pay attention to our social media. There'll be some dates coming out in July for those forums. And Rachel and Tiffany, you know, you'll get notification of those dates, and you can share them if I don't reach everybody on this call.
I think that's valid, Kevin, and thank you. And I just want to go back to what Zuma described in terms of making sure we're having a platform to hear from those recipients, those that what we call with lived experience. You know, I'm able to talk about SNAP a lot because I was a college student who was food insecure and had to receive SNAP. And so making sure we keep those individuals that are accessing our supports, we keep their voices at the forefront. We do opportunities for those individuals to talk to our legislators, to collect stories so that it's not coming from the professionals, that it's coming from those who are most in need of services.
Great. Well, I think that brings us right about to our time. So I'll turn it over to Dani to close us out. But thank you all so much for this conversation and for everything that you do.
And thank you, Rachel, for moderating this discussion. It was just such a fantastic discussion. And thank you to Congresswoman Fudge and to Eyang for joining us and for answering questions and adding to our panelist discussions. And thank you, Zulma, Kevin, Will, Tiffany, everyone for participating today. And thank you to the attendees for staying with us and for asking such wonderful questions throughout. Did want to let you know that we will have a recording of this available by Monday on our website. You can see the short link in the chat box. It's COMSOLS, COMMSOLS.com/webinars. So it should be listed there by Monday, and you can also see recordings of all of our previous webinars there that we've been doing weekly since March. So thank you again to everyone, to the panelists for participating, to everyone who joined us for this important discussion, and please stay safe and healthy. And I'm sure that we will hear from you all and hopefully see you all soon. Thank you so much.
Thank you.